Hi, and welcome back to Lecture 1. This is our Week 1 and Module 1 lecture for Epidemiology Matters, the first chapter. So, after talking about evolution of epidemiology and our approach, we'll start getting into the 7 steps to conduct an epidemiologic study. As we discussed in the previous part of this lecture, epidemiology of consequence is a style developed by Kais and Galea, talking about taking an ethical approach to epidemiology. And there's been many unethical things, as you remember, the Tuskegee syphilis study and other population health studies that haven't regarded the consequence both to individuals and communities and things like that. So I find this particularly important in our study of epidemiology. Just to summarize, we'll go through each of these in more depth on the next slide. So defining each step according to which part of the analysis that it belongs to. So starting with descriptive epidemiology, we define the population of interest, conceptualize and create measures of exposure and health indicators, take a sample of the population, estimate measures of association between exposures and health indicators of interest, and then in the next part, where we're assessing for causal effect, so whether this exposure was really the cause of the disease. Step 5 is rigorously evaluating whether the association observed suggests a causal association. And then the third part of the analysis is conceptualizing and testing for interactions. So step 6 is assessing the evidence for causes working together. And if you think about it, so many of the patients that we've seen, that we've known, or that we've been ourselves have multiple causes working together to manifest into a disease. So this is step 6. Step 7 is assessing the extent to which the result matters or is externally valid to other populations. So now we'll talk about Farlandia. Examples in this book are often based on hypothetical geographic data or geographic area called Farlandia. It's inspired by William Farr, a pioneering epidemiologist and statistician. Through the use of Farlandia examples, students, meaning all of us, will focus on applying foundational concepts to populations while working with this book. So in summary, this book really aims to provide people with a systematic grounding in the theoretical underpinnings of epidemiology, with an awareness of practical considerations that are essential for us as public health or community health professionals. So this text establishes a foundation by building on methodological innovation and teaching of the previous century while adopting a novel approach to teaching these epidemiological foundations. And I'd like to give credit and a big thanks to the way that this book is done. Until I found it, I was hard pressed to find a text that really addresses methods and in a very ethical and correct and considered manner. So I'm looking forward to working with you all this quarter, and I'm looking forward to the book and a lot of resources provided by the book, such as all of these wonderful lecture slides, which are a summary of the book. So please, also, you're still accountable for what is written in the chapter. Don't skip reading because you've seen this lecture. The lecture is sort of just a sneak peek or verbal confirmation of what you read. It's still really important to read. And your reading will help you with other resources that are available through the book, which will be the online exercises. Though you might see it on the first page that there's a website, which is a really great website, but it may not be up to speed yet. They are reconstructing the website. So in case online materials aren't available, or when you open the website of epidemiologymatters.org and you don't find a website, then I will be providing on the online exercises, which will be done with your classmates. So the experience of workshopping these problems will be part of this sort of greater study of epidemiology that you'll be doing, which is sort of reading, practicing through homework problems, and workshopping with your classmates. So there's a lot of really excellent resources available through this book, and I encourage you to just dive in, enjoy, and always contact me if you have questions about the reading, about the homeworks and everything. And feel free to let me know anytime, because any clarifications you need, chances are your classmates may need them too. So definitely get in touch, and I'm so much looking forward to working with you this quarter and going through this study of epidemiology together. So have a great week, and I'll catch you next time.